So we met for a Meet the Expert session at breakfast today, discussing the role of CAR T therapy for patients with lymphoma in 2024. It was a nice chat. It was an informal chat with a group of clinicians from around the world. I was impressed with the geographical distribution of the attendees I had this morning from Japan, US, Australia. So it was really good, and it was a nice interaction about understanding variations in practice. So I learned from interacting with colleagues around the globe. We were discussing the currently approved CAR T-cell therapies in lymphoma. So we discussed second-line approval for diffuse large B-cell lymphoma in patients relapsing early after first-line therapy, as in either primary refractory disease or relapsing within 12 months of first-line chemoimmunotherapy. The two products approved being axi-cel and the liso-cel. And we were discussing how you take these patients through the CAR T journey, the bridging process, when we use bridging, what bridging therapies to use for these patients. And also we covered the issue of older patients who are not traditionally transplant eligible, and should we be considering them for CAR T-cell therapy. In particular, we looked at data from pilot and ALYCANTE studies, which are both phase 2 single-arm studies, looking at transplant ineligible patients in the second-line setting and showing very encouraging data for response rates and progression-free survival in these patients groups. And then we covered third-line CAR T-cell therapies and CAR T-cell therapies for mantle cell lymphoma, and exploring the patients with comorbidities, patients with clinical indications that are not conventionally covered by clinical trials, as in patients with secondary CNS lymphoma, for example, patients with Richter's transformation who are not routinely included in clinical trials, and looking at the real-world data which has been emerging, informing us about how we incorporate CAR T-cell therapy for treatment of these patients.